Welcome back to At the Heart of Health. We're visiting today with Dr. Carrie Melvin. She is director of the Hospice of Chattanooga. And I heard the Hospice of Chattanooga recently did some great things as far as accreditation. Could you tell us about that?
We're CHAPS accredited, and the exciting thing for me is there is now a subspecialty in hospice and palliative medicine.
Wow.
And we have our first fellow. He started this past July, and I found out Friday that through the ACGME, we are accredited for 3 years, and we work with the University of Tennessee, the internal medicine department.
Well, that's a great achievement. You know, and I think it's one of the things we like to accomplish today is letting people understand that as our population gets older, we have to have more people trained and specialized in caring for elderly, because it's a really whole different breed of patient.
Yes, it is.
And I think this next question is sort of going to address this. And this person withheld their name, and they write, they say, talking about my own death I find difficult. We talk so easily about everything else in healthcare. It's not popular. I went to talk to my doctor about my death. Evidently, this person's getting up in age, and he wanted to two-step the issue. I hope you do not sidestep me as well. Not many ministries or people deal with dying. Here's my concern. I am scared of dying despite being a Christian my entire life. Is this normal?
Yes, it is normal. The fellowship program and the specialty in end-of-life care is a whole different set of problems that patients and families experience. Just like from a cardiology standpoint, if I have pressure, fullness, pain behind my shoulder blade, one of the most common questions that we see or we'll hear is, I have a very strong faith base, but I'm afraid. Does that mean that my faith base is not as strong as I thought?
Right.
And you know, the answer is no.
No.
But not knowing is fearful. Not knowing is fearful. Fear that I may not be in control. Fear that I might have left one thing undone. Fear that I may not have said all of I'm sorries to all of the people that I may have encountered through the years. Leaving my loved one behind. Younger people who have been the breadwinners in their family, leaving their wife and young children, okay, can be extremely uneasy. When the time comes, this gentleman will feel an enormous amount of peace.
Now, how do you facilitate that? It sounds like he's looking for peace right now, and he's not getting it.
Yeah, I think that there are probably some other issues that still need to be addressed. We think about the end of life. I like to equate it to pregnancy. So you come home and, honey, I'm pregnant. Okay, the baby just didn't come then. It was a process. Just like your end-stage heart patients, they come back and forth into the hospital over a 4 or 5 month period. There's transitions. Okay, and sometimes people want to rush it. There's no light switch. You know, it's to look at the day and say, what one thing I want to achieve today? Because I'm not going to do anything today without the Spirit being with me. You know, He probably has some issues that he really needs to talk about.
But it is normal that a person of faith
Yes.
have these.
Absolutely.
And it's just sort of moving through that.
It just just moving through the little
Good.
process.
Good.
Yeah.
Well, we hope that helps you. Let me move on to, this is a question from Kansas. It says, can hospice care be given in a nursing home or hospital?
Yeah. Hospice care can be given where the patient resides. It could be in the home. It could be in assisted living. It could be in the nursing home. It can be in the hospital. Okay? We have picked up quite a few patients in the hospital when an acute event occurred and that patient may not make it home.
Right. So that's an option.
Yes,
Okay,
it is.
Okay, here's another good question. This is a short question from a person in North Carolina. It says, if a person cannot swallow, how would you give pain medicines and nutrition?
If they can't swallow, we can give medicine subcutaneous, just like they give insulin.
Okay, under the skin.
Under the skin. We can give it rectally. We can even give IV fluids subcutaneous. The question I have is the nutrition, is it for the patient or for the caregiver?
Well, they're not too clear on this. So I think they're mainly interested in making sure that there's a way to give pain medicines before hospice if they can't swallow.
Right.
I think that was a concern on this one. Here's a good one that comes from Washington State. It says, we have limited resources in our family. I have an aunt that's 84 and lives alone next door. She hasn't much time to live. She can barely walk across the room. The question is, will insurance, this is in Washington State, does insurance usually help with hospice care?
Yes. 1982, the Social Security Act was amended. And in addition to traditional Medicare, there is a hospice component. And that component is covered at 100% for the illness and those medicines as it relates to that illness.
You know, what strikes me is, you know, we're in a healthcare crisis in America now. Americans aging, and yet we know that a lot of the healthcare dollars that's spent is spent in hospitals the last 6 months of a patient's life.
That's right.
You would think that legislations, viewers, people would be in an uproar to help this type of healing really occur, because this is a lot more healing than you're going to get in the hospital sometime. You're going to get people that are trained, know what they're doing. That we might know as the disease states, when it's definitely identified that you're end-stage disease. You know, it would save the system a lot more if we could increase the education of people to say, listen, this is hospice, this is the way to go.
Or to at least let them know that that's a choice.
Right. Yeah, and I think it's a big educational thing. I mean, I think a lot of the other providers don't know all the services that's involved.
We've also had an influx in the number of for-profit hospices that have come about.
Well, that's going to be, you know, you're going to see people wanting to make a buck. Let's be honest.
Right.
You know, people say, listen, this is a chance to make a buck on the system.
Right.
And I think there's a difference between non-for-profits and for-profits.
I do too.
And you have to really judge the care, you know, and judge the care and judge their hearts.
Right.
Because I think, you know, one of our models here is at the heart of health is love.
Right.
And if a 501c3 has love, great. If a for-profit has love, great. So, I mean, we really have to look at each one separately.
Our shareholders are our patients.
Right.
Our shareholders are the families that we touch.
Now, we have many questions. We're never going to get to them all here, but we have a couple minutes left here. Is there anything you just want to share from your heart to all of our listeners across the United States and world? Now, we're going to have you back again to answer some of these other questions, but is there anything that's just burdening your heart that you want to share?
I think that a lot of physicians are not comfortable saying, I've done everything and I can't fix this. We don't really fix anything, but there's always something that we can do to help the patient and the family through the journey.
Right.
And people shouldn't have to be alone. And people can change, you know, right up until the end.
Well, thank you. Thank you so much for sharing. And one of the things that I found great comfort in is no matter how bad things are, we always know that God has promised us that if we have love in our hearts, have Him in our hearts, that there will be ultimate healing. And when we can't fix the physical needs, we also have to work on the spiritual needs. And that's probably more important on a universal scale than anything else. I want to thank each one of you for joining us today as we've been with Dr. Melvin and talking about hospice care. We want to invite you back next time. We're going to be talking about another interesting topic. And please send in your questions to the website. We'll answer your questions either on air or on our website. Thank you for joining us today. Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy.